Hi, my name is Yvonne, and I'm here to share my fibroid story with you. I recently had a surgery about 2 weeks and 2 days ago, and that was my second fibroid removal. In December of 2019, I had a severe pain. I was actually sick for 2 weeks. 1 week I couldn't move at all. I was in so much pain. And then the second week I was able to go to the doctor, and I saw three doctors, and they said I had to remove the fibroids, which previously I've seen other doctors and they've said the same thing. But being as they never bothered me. I know my stomach was pretty large, but I never had a problem with my stomach being so large, and it didn't bother me, Of course, other people looking at me, they thought I was pregnant, but that didn't bother me. It didn't bother me at all. So one of these three doctors suggested this one doctor to me and said, let me check him out and see if he has something else different from my previous doctors to say. With my previous doctors, I think they try to make the choice for me to have a hysterectomy, and hysterectomy is what I didn't want at that time. I was like 35, and they were suggesting hysterectomy. They were suggesting a hysterectomy to me, and that's not something I wanted. And I just thought they were just making a choice for me. They gave me three choices and then told me this is the best one for me. And I didn't take them up on it. But anyway, this doctor, I had a first meeting with him. It was a telephone conference, and he introduced himself and told me he would be the doctor taking care of me. And due to COVID, I wasn't able to see him until July, my first time seeing him. So when I saw him in July, he told me there are two options, and I have to decide which one is best for me, and asked him what I wanted for the future, etc. And I told him I know exactly what I want, and he said, okay then. So then he asked me what I wanted, and I told him what I wanted, and he said, okay, he'll make that happen for me. And he also boasted and said his exact words were, he said, most doctors do this surgery like 3 a year, and he does at least 3 a week. So that was pretty impressive. But I was a little bit skeptical about him because he said this was the biggest fibroids he's ever seen. So I'm like, okay, if this is the biggest fibroids you've ever seen, how are you going to get this out of my stomach? I mean, mind you, my stomach is very large. If you know me, my stomach started from over here. Actually, it was my uterus that moved up to here. So it was very large. Everyone thought that I was pregnant. Actually, most of them thought I was like 8 months pregnant. But anyway, he said he can do it. I said, okay. So we set up all the appointments leading up to surgery. I had a doctor clearance, blood work, cardiology clearance. 3 weeks prior to the surgery, I had like a sharp pain under this area, under my breast area, close to my heart. So I told the cardiologist about it, and he did his regular testing, and then he did a further testing to make sure everything was echocardiogram, which it was called an echocardiogram, which was further testing to make sure that the heart was working properly. And went back to him, and he said everything was clear. He asked me if I can breathe properly. I said yes. So the surgery was on. 2 days before the surgery, I had a severe back pain. I don't know what it was. Just a severe back pain. I couldn't sleep. And I was thinking to myself, maybe these are signs that I shouldn't have the surgery. But I really wanted to have the surgery because I think prior to the December 2019 episode, I had 2 other episodes that was painful, but not as painful as that December episode. But anyway, October 23rd came around, and I was still a little bit nervous about it. Went into the surgery feeling nervous, and then I went into the hospital, checked in, filled out the papers, and they gave me back the papers. They called my name, went in the back to the nurse. She did her testing, urine test and everything, and she was pretty funny. Made me laugh, so I relaxed a little bit. And then my husband came, met me there, and we were just talking, relaxing. All the doctors came, they checked me out, did their regular checkups, make sure everything was okay, asked me, about allergies, etc. And finally the hour came, I had to go in. It's like, okay. And then, the nurse had to do her clearance again, and she was like, oh, you had this already? I was like, yes. She's like, so you're gonna be okay. I was like, okay. And I think I relaxed then. I was more relaxed by then. Went into the room, and they just, I guess, gave me they introduced themselves. They all introduced themselves to me, gave me the anesthesia, and fell asleep. I didn't know of anything after that. Don't remember anything else after that. Then I woke up. I think the surgery was supposed to be at least 2 hours, but it actually took 5 hours because while I was having the surgery, the doctor said as soon as she placed me to sleep, she saw that I had a hernia, and she had to call another doctor to do that surgery and get take care of that hernia. And inside of me also, my uterus was connected to the colon. The colon is what the feces that holds the feces. So that was attached to the uterus. So he had to detach that, and that was another surgery. And inside of me, I had 51 fibroids. He had to remove 51 fibroids. So he had to cut out all that fibroids out of my uterus. So I lost at least half of my body's blood. When I woke up, I felt like I was gagging. So I was moving around, and they was like, oh, she woke up. And then they put me on the stretcher, and then I rolled out to the recovery room. I stayed there for a little while, and the nurses were watching over me, make sure everything is okay. They were giving me blood. They had to replace all the blood that I lost, give me, like nutrients and all those things, vitamins and all those things to help me get back to the level that I was before the surgery. And they, before anything, my husband came in again after surgery and spoke to me and told me what the doctor said. And then a few minutes after, I saw the doctor, and he was explaining to me what happened. He showed me the fibroids that were in my body, etc. And he just told me to relax, and they're just replacing, giving me back all the blood that I lost, etc. Basically, it was a great experience. Had a great experience at Brooklyn Hospital. Kudos to the nurses, the doctors, and of course,